Hilton. She's an independent AmeriPlan business owner. How you doing, Malika?
Hi, how are you?
I'm doing great. Thank you for asking. So tell us, what is AmeriPlan?
Well, AmeriPlan is a medical benefits discount organization. And what we offer is up to 80% on all your medical or dental expenses. 80% for people who have insurance or if you don't have insurance. We've been around since 1992 and we're part of the Better Business Bureau. A plus rating.
You guys have an A+ rating with the Better Business.
An A plus rating.
So are you? Is AmeriPlan insurance? Is it an insurance company?
No, we are not insurance, nor do we affiliate ourselves with selling insurance. What we offer is discounts to our people. If you have insurance, then it's a good supplemental to your copay. So what we cover is any out-of-pocket expenses. If you don't have insurance, I'm sorry, but if you don't have insurance, we will also cover that for you as well.
So if you don't have insurance, meaning no type of help or assistance, financial assistance in any way to pay for your medical expenses, you can save up to 80% on your out-of-pocket, which is your entire bill,
yes,
medical expenses.
Yes.
And if you do have insurance, which covers majority of medical expenses, any out-of-pocket money that you may have to pay, anything like copay, deductibles, premiums, things like that, you're eligible to save up to 80% on that as well?
Yes.
I see. Okay, so what is AmeriPlan?
AmeriPlan is a discount medical program organization. We arrange for our members to have access to medical, vision, dental, chiropractic, and pharmaceutical providers who have agreed to offer their services at negotiated discounts from their usual customary fees.
How much discount do Dental Plus members get on dental fees?
Members can save 25 to 65% on all restorative and cosmetic work, and up to 80% on all preventive work performed by a general dentist. Specialist fees are discounted up to 25%.
Are ongoing dental and medical problems or conditions included?
Since AmeriPlan is not insurance or a health organization, all ongoing medical or dental problems are accepted except for contracted treatment plans for orthodontic treatments in progress.
What is the waiting period?
There is no waiting period before you start using the program. And there are instant savings, no paperwork to fill out, and no limits on doctor visits to your providers.
How much is the program membership fee, and how do I pay?
Well, the Dental Plus membership is only $19.95 per month for an entire household. A household membership includes all residents in the household, including parents, children, relatives, significant others, and all permanent residents of the household. Monthly or quarterly payments are made only by electronic bank draft or credit card. Invoicing is done only for annual memberships paid 1 year in advance.
How much more do the pharmacy, vision, and chiropractic programs cost?
The prescription drug, vision, and chiropractic programs are all included with both the Dental Plus and AmeriPlan Healthcare membership at no extra cost.
Who are the medical, dental, prescription, drug, vision, and chiropractic care providers?
AmeriPlan has assembled one of the largest networks of providers in the country. We are constantly adding to this database. Our network has tens of thousands of medical practitioners and more than 30,000 dentists and 12,000 vision care providers, approximately 50,000 pharmacies, and more than 7,500 credentialed chiropractors.
How do I use the program?
Within 10 to 14 days of receipt of your application at the corporate headquarters in Plano, Texas, you receive a membership information guide and membership identification cards. Present your membership IDs to any AmeriPlan provider, and you will be eligible to receive discounted fees. You pay the provider at the time of your service.
Can I purchase the AmeriPlan healthcare program without including the Dental Plus program?
No.
Will AmeriPlan healthcare program members receive a discount?
Yes.
Why would a medical professional participate in the AmeriPlan consumer-driven healthcare program?
Well, there are many reasons. Some of the most important are patient care and treatment are put back into the physician's hands. The provider gets paid at the time of care. Many insurance plans take up to 120 days for payment. Office administrative costs are reduced. No paperwork to complete, file, or follow up on. Providers may receive a net increase in revenue to the practice versus insurance. The provider is part of an affiliation of like-minded professionals without being under the thumb of managed care. AmeriPlan provides members with quality discount healthcare.
Can you briefly describe the hospital advocacy program?
Sure. The hospital advocacy program is designed to help members with their medical bills whenever a single hospital visit totals $2,500. For the insured, this means that the amount that you are personally responsible for, aside from your deductible. Charges can be incurred from multiple providers. The patient advocate negotiates on behalf of the patient and pursues a wide range of options, from government entitlement programs to payment plans. There is a waiting period of 3 business days from the active date of your membership to utilize this program.
How is the discount calculated?
The rates that the provider charges are determined based upon the set fee schedule that the provider has contracted, or as a percentage of their billed charges. In general, discounts will vary between 30 and 50%. Labs and diagnostics will have discounts of up to 80%.
Is AmeriPlan Healthcare contracted on an annual basis and cancelable at any time, like Dental Plus?
Yes.
How do I locate an AmeriPlan Healthcare provider?
There are 2 ways to locate a provider. A provider locator is available at www.ameriplanusaprovidersearch.com. This is particularly useful for medical providers. Or you can call our membership service toll free at 800-647-8421.
Can the AmeriPlan Healthcare program be used with Medicare or Medicaid?
No, Medicare does not allow their providers to charge a Medicare patient a different price.
Are doctors reimbursed by AmeriPlan for their services?
No. As with all of our health programs, the provider receives the full discounted fee from the member at the time services are rendered.
Can members downgrade from AmeriPlan Healthcare to the Dental Plus program?
Yes, they can.
If the doctor's office has lab facilities, can these be utilized rather than having to go to another lab?
Yes, the lab services will be built up to a 40% discount.
Do members receive a fee schedule?
No, fees will vary by area.
Do members receive a separate card for the AmeriPlan Healthcare program?
Yes, approved household members receive 4 cards, 2 AmeriPlan Healthcare ID cards, and 2 Dental Plus cards.
Are there programs for emergency services?
Yes, emergency services may or may not be contracted with the AmeriPlan program. Depending on the extent of the charges, these services may be eligible for a hospital advocacy program.
Will the members' privacy be protected?
AmeriPlan is compliant with all HIPAA regulations.
Does AmeriPlan Healthcare include hearing tests and hearing aids?
Yes. Hearing services will be included under our ancillary services providers.
Does the AmeriPlan Healthcare member have a choice of which hospital will be used?
Yes, they do.
Great. So Malika, to get started and take advantage of your services, where can we reach you?
Well, you can always contact me at 615-461-0281, or you can reach me on my website at www.mybenifitsiplus.com/medical savings.
So Malika, I understand you are a certified notary public. You have your own speed dating service, and you write newsletters for local apartment complexes in the national area. You're also a wife and a mother of 3, correct?
Yeah.
Wow. So tell us, why did you go into business for yourself?
Well, I went into business for myself because I wanted to do something, but at the same time, I wanted to just be close to my family. I enjoy being there for my family. I enjoy being in business for myself without having a boss on my back and without having just being able to do different. That's another way.
So if you had any advice for a first-time individual or someone thinking about starting their own business, what advice would you have for them?
I would say find something that they're passionate about. I wouldn't say do it all for the money, because if you do it all for money, you'll have a lot. It'll be harder. It'll be a bigger struggle. Um, so if you find something that you're passionate in, for AmeriPlan, for example, I enjoy helping others, and I feel like this is one way I can help others. It's helping them save money on their discounts, on their medical bills. And medical bills is actually one of the leading expenses that one can have. So just using that as an example, I took passion in that, and that's what the advice I would give. Let it be something that you're passionate about.
Thank you, Melissa.
Thank you.
Outstanding. So then you continue to walk with passion. This is Donovan Hilton, creating awareness of the resources around you with love. Till next time.